Alberta has put the brakes on its plan to eliminate many key COVID restrictions on Monday. The province's top public health doctor says hospitalizations have risen more than expected, so testing, tracing, and mandatory isolation will remain in place for another 6 weeks.
We are not going backwards. We are pausing to monitor and assess before taking a next step forward. Having said that, I am sorry that the way that I have communicated about these changes and the rapid pace of them has caused distress.
Many doctors, parents, and local officials have been vocal about their opposition to ending the pandemic restrictions. Dr. Noel Gibney is a professor emeritus at the Faculty of Medicine at the University of Alberta. He's in Edmonton. Dr. Gibney, officials now say they will pause the upcoming easing of some of those public health measures. Are you satisfied with the plan you heard today?
Katie, thank you for having me here today. I think many people will be very relieved. There are some issues, however, with the plan, most notably that although testing will continue for at least another 6 weeks, tracing is somewhat diminished in that although individuals will be notified that they're positive and requested to tell their contacts that indeed they've tested positive, the tracers will not actually do the contacting of the individuals who may have been infected. And I think that is a significant weakness in the public health measures that are going to be in place in Alberta going forward. And I think that the second issue that I would have some concerns about is that although school boards within the province can institute mask mandates in their schools, the province decided not to do that today. And I think that puts those school boards under some pressures potentially from groups within society that may pressure them not to put mask mandates in place.
The first issue you raised there about tracing, are you worried? It's sort of like the honor system. You have to, it's up to you to reach out to those you may have been in contact with. Are you worried that people, I don't know, might be embarrassed or might not want to tell people? I don't know what it could be, but are you concerned that people won't necessarily abide by that?
Yes, I think that there's a significant risk that people will not abide by that. And that's a significant problem because people are COVID shamed, and one hopes that won't happen, but human nature is what it is.
Dr. Deena Hinshaw cited rising ICU numbers as one of the reasons why they're not lifting more restrictions. Cases continue to rise there. Does Alberta need more restrictions, or is what's currently in place good enough?
I think where we are now is good enough, but if this continues for another 2 weeks with cases doubling every 10 days, I think certainly by the end of the month, we'll be looking at approximately 2,000 cases of COVID a day. And I think at that stage, further restrictions are likely going to be needed. In particular, I think masking is one of them, which was reinstituted today in public transit. It's very possible that other masking restrictions, such as in stores, etc., will also need to be imposed at some point in the coming weeks.
2,000 cases a day. You know, we've had in Canada, vaccines have been available for months. Although there are some barriers for some people to be getting vaccines, generally, for the most part, everyone who wants a vaccine can get a vaccine. What do you make of the fact if we do hit in Alberta 2,000 cases a day? We are seeing cases tick up in many provinces: Ontario, Quebec, British Columbia, Alberta. What do you make of these cases ticking back up to levels with a trajectory where it could be in a spot where, you know, perhaps we saw when we didn't have vaccines?
It is a real problem because what makes the Delta variant so different from its predecessors is that it is so much more transmissible. And not only can non-vaccinated people transmit it, but vaccinated people with little or no symptoms can also transmit this and cause problems. And so I think we are facing a situation where we may see our numbers, particularly towards the middle of September or towards the end of September, exceed anything that we've seen before. The good news is that vaccinations work. And even if vaccinated people have asymptomatic infection or mild infection, they typically don't go to hospital or end up in ICU. But at the same time, we are potentially, if we can go to 4 or 5 times the numbers that we had with the second or third wave, there's still a risk within this fourth wave that we could overwhelm our hospital system again. And so one wished that this would just go away and that we could pretend it isn't here, but it is. We're going to have to deal with it. And further measures may need to be put in place, particularly masking.
We're on the eve of a federal election campaign, and campaigns traditionally are about bringing people together and connecting with people. And so much of that in the past has been done in person at rallies and major events. Can election campaigning be done safely from your perspective?
I think that's a very good question. Dr. Tam answered that yesterday and suggested that I think we will see more virtual campaigning. The timing certainly isn't ideal, but it has been decided. I think that we will see a lot more online. We'll see a lot more television. But I think that the days of individuals coming to knock on the door, I think we're not going to see very much of that. And probably that would be advisable that didn't happen.
Dr. Gibney, thank you so much for your time today.
You're welcome, Katie. Thanks.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.